Today on TAL Health Talk, we are bringing to you a conversation that is deeply human, often silent, but incredibly important: awareness on infertility. We are joined by Dr. Vinatha Puli, Senior Consultant Obstetrics, Gynecology, and Urogynecology at Cloud9 Hospitals, with 2 decades of clinical experience, including extensive training and practice in the UK. Her work spans across fertility counseling, high risk pregnancies, recurrent miscarriages, and holistic reproductive health, supporting women not just medically but also emotionally during the most critical phases of their life. Today, we are looking at infertility beyond a condition but as an emotional landscape and a topic that we often need to talk about. Welcome to TAL Health Talks, Dr. Vinatha.
Hi.
We are very happy to have you here to talk about a topic which is normally talked in a very hushed tone in our country, which is infertility. First question to you is, as I had mentioned earlier, infertility is often spoken about is in a very hushed tones, very secretly. So from your experience, what is the emotional reality that couples go through in this situation?
A very interesting point to start with an emotion through fertility. It is very, very important these days to understand these emotions. Fertility is really, I don't know why, I think it is getting better that people are now approaching the doctor sooner and able to talk a little free, at least to their peers and friends, though not families still. I think partly it might be due to the stigma that was
Yes.
associated so from long years, and also I think when the whole family talks about when are you having, when is the good news, I
True.
think it puts them off. So it is like a pressure somebody can feel, as if they
Absolutely.
are going through an exam or something. So I think these are all the reasons why people don't talk openly to family. And the moment someone utters, oh, actually we are trying, then everyone will be around them, will give advices. People might not like it, but they give advices. They feel that's too personal intrusion into their privacy, talking about all these things. So maybe they don't want to talk about it. So all these factors might influence why they won't talk about it so much. And emotionally, I think it is the pressure, it's the stigma. They feel drained about all these situations. So I think they most of the time they decide to take it between themselves and then approach the doctor later.
Yes,
And
doctor.
sometimes we feel they talk to doctor openly than to their family.
Okay.
And most of them they come and tell, please keep this confidential to family, because they don't want to, or friends, they don't want to discuss this openly, and they don't want to let everyone know there is a problem.
True, doctor. There is a lot of expectations and a lot of
Yes.
pressure. I believe as a society, we are yet to evolve
Evolve.
and
Yes.
understand that there is no pressure on the couple to have a child
Yes.
immediately or even have a child for that matter as per
Yes.
the adults' expectations, the elders'
Yes.
expectations.
Yes.
Right. So, my next question to you, doctor: do you think infertility today is increasing or are we just talking about it now?
Mm. Both.
Okay.
Infertility is also increasing, and people are also coming. Maybe in very older generations, that when we were kids, it's like hardly talked about. Oh yeah, that couple, they didn't have kids. That's it. But we don't know the reasons, anything. But obviously, coming to the doctor with the problem is increasing now,
Okay.
and fertility problems as such are increasing. Maybe it's
Okay.
so many factors, our lifestyle factors have changed, stress levels have increased, expectations have increased, and when we plan, that is also increased.
Yes.
Age is increasing. So maybe there are so many factors behind why we are seeing fertility problems more, but certainly we are seeing fertility problems more
Yeah.
than just coming and openly talking. The problems are also on high.
Yes. I think even the food we consume,
Yes.
the air we breathe, our
Yes.
environment, everything is
Everything.
playing a role.
Yes.
Okay, that is really
Yes.
scary. So that's why we would want
True.
to
Well,
understand from you how
hmm.
can we handle
Yes.
this.
True.
So, what are some of the most common reasons you see behind infertility happening in a couple, doctor?
I think the main thing is when couple plan to have kids, that age of them is increasing. mainly the female of the couple, their increase may be partly to do with, studies, settling into the career, then late marriages or late relationships, and then plan also kids later. Sometimes they decide not to have the kids, and then over the period of time, after many years, then they feel no, maybe we should. They come back to their own decision. So the planning time itself, like age of the couple, that is one bigger factor. And also environmental and lifestyle factors. So though we see many women now who are in late 20s, which is considered to be still very ideal time for planning pregnancy, have already problems, like maybe with lifestyle things, like very sedentary lifestyles. Most of the jobs are now sitting jobs, not much of a physical activity.
Yes.
And these are certain things that we cannot undo completely, though we have to try hard means and various other means to make it. But there are certainly these factors adding to the hormone imbalances.
Okay.
Stress will add to hormone imbalance. All this will contribute to fertility problems, though not just age.
Okay.
And so we see this in younger people also.
Okay. So how about men, doctor? You had shared about the
Yes.
challenges that happen in a girl.
Girl.
So how about men? What kind of challenges happen in them?
Yeah, men also. I think many are now into so many addictions.
Okay.
That is something that has come up. Alcohol and smoking once upon a time is considered stigma, is now considered fashion.
Yes.
Drugs, they are all increasing. So these are major contributors. And again, for them also, lifestyle factors. Many men now are becoming obese, their sedentary lifestyles. This will contribute to sperm quality,
Okay.
along with addictions. And working in hot weather, wearing tight clothes, these are also added things. So apart from lifestyle factors, these are also something that men should also look into. And definitely age is one thing, but that will come a little later for men compared to women. So women at 30s only we are seeing problems. For men we usually see after 40s and 45.
Right, absolutely, doctor. That is very,
Yes.
insightful. So, how much of fertility is biological, doctor, and how much is influenced by lifestyle, stress, and the way we live today?
There is an overlap.
Okay.
Biological, certainly, yes. If I say age influencing fertility, it is
Yes.
biological.
Right.
We might not really be able to modify much, and we only have to take what comes now.
Okay.
But that also is modified by lifestyle factors. See, age, as I said, same age, 28 to 29, is once considered to be very fertile. Some people are finding it difficult because of lifestyle factor adding to the age.
Okay.
Like, imagine a woman in 28. She is having sedentary lifestyle. She has lots of weight now put on because so much physical activity. Lot of stress in her job. So these are all contributing to her like age. So there is more problem of fertility.
Right.
Compared to someone who is very active, 31 years, but age is a factor still, but no major stress. She doesn't take stress. Her active lifestyle, very healthy diet. So maybe more than age, her lifestyle will actually help
Help her. Right.
help her.
Right.
But at the same time, I cannot say that okay, if you have a very perfect lifestyle, you will overcome all the biological factors. No.
Right.
We cannot undo some biological factors like age.
Absolutely, doctor. So this applies both for men and
Men
women.
and women.
Men and women, right?
Yes.
So here, as my own personal experience, post puberty, when I was going through the monthly menstrual cycle, I used to have a lot of pain, and I've seen many of my classmates going through a lot of pain. So at that time, we used to take a painkiller. I don't want to mention the name, which was later banned by the government.
Yes.
So that painkiller we used to just pop in, and then we will continue with the classes.
Protein, yes.
Right. But during my pregnancy, when we did the scan in the 3rd month, that is when a fibroid was detected. So there is, right now the PCOS and PCOD people are identifying immediately. So on that thing, what would you like to suggest, doctor, to women?
See, there is an advantage and disadvantage for that.
Okay.
Certainly, we don't have to have the difficulty, or you don't have to suffer with pain,
Yeah.
which is considered to be a norm. And
Yes.
people just put it off, saying, okay, that's normal to have pain. But for some, it is not considered to be normal.
Yes.
They struggle with their routines. So it is not as simple as, okay, just another day, carry on with your
Yeah,
work.
yeah.
They have to take time off. It really takes a toll. So for them, that is a struggle. So we have to help them identify the problem.
Yeah.
We need to do more tests, maybe scans around that time.
Yeah.
Might have identified a fibroid. That is one factor, and maybe planned in a better way. So we know that there is a fibroid. We know pregnancy can be, and no, it's not like coming as a surprise.
Yeah.
The first scan you do in pregnancy,
Yes.
it's not coming as a surprise. On the other hand, sometimes people do get very, very anxious.
True.
So you just do a routine scans. So nowadays it is very, very common. There is no problem. People just get a routine checks, annual checks, and
Yeah.
scans, MRIs, everything. Just
At the teenage itself.
Yeah.
Yeah,
So,
actually, it
people
makes-
are getting the
yeah.
tests, and then that starts the worry. Like
Okay.
we'll identify a small fibroid. That has not caused much of a problem, but
Okay.
now that's a thought put into the head.
Yes.
There is a fibroid. There is a fibroid. What will happen to my health? What will happen to
Yeah,
my periods?
yeah.
What will happen to fertility? So much of anxiety builds over it. So we
Okay.
don't know whether knowing something later, which
Yeah.
has never caused much of a problem,
Okay.
then maybe, we don't know. But teenagers, I won't suggest any routine tests or anything.
Okay,
But
okay.
certainly, as the age is going, as the years are passing, if we listen to our body
Mhm.
and something changes in us and we think, no, this was not my previous thing,
Yes.
then certainly getting checked and, tests might help.
Okay, it's advisable.
Yes.
Right. Thank you, doctor. When it comes to infertility, there are many myths surrounding it. Right,
Yes.
like when it comes to menstruation or pregnancy, there are a
Yes.
lot of myths that we hear
Mhm.
about.
Mm.
So, can you share 2 to 3 myths that people
Okay.
shouldn't believe
Believe.
about
One is-
infertility?
Yeah, one is maybe first, as you mentioned, painful periods.
Yeah.
Painful periods, some will consider, oh, you have painful periods, you might have problem with the pregnancy.
Okay.
So that's not true. So, or sometimes the other side also. Regular painful periods, it's good, okay.
Okay.
It will go after pregnancy.
Mhm.
So many
Right.
people will just put it off, saying that after delivery your pain will go. After you get pregnant, the painful periods will disappear.
Okay.
So actually, that is not something like, maybe
Okay.
there is no much evidence behind,
Okay.
and we cannot constitutionalize everything as one common thing. So
True.
all painful periods are not worrying, but there might be some concerns.
Mhm.
That is the reason my baby they are having pain. That
Okay.
might have a problem to fertility.
Fertility. Okay.
Like, for example, there is a condition called endometriosis,
Yeah.
which will lead to a lot of painful periods,
Mhm.
and they gradually get worse.
Okay.
And in them, painful periods, it's not a fertility sign. Painful periods in them is an infertility
Okay.
predictor.
Right.
So, but it's stigma. So,
Mhm,
painful
mhm.
periods causing fertility or painful periods no fertility problems,
Okay.
both are not true.
Okay,
So that
doctor.
is one stigma.
Okay.
One other thing is more of like, previously only female used to come if there is a fertility problem.
Right.
If they are not having kids, they'll get only
The girl.
the girl,
Yes.
thinking that I'm looking fine, I'm
Yeah,
perfect.
yeah.
So might be problem. That is actually getting better these days.
That's
We
good.
hardly see only one person coming for fertility concern.
Okay.
Nowadays, at least in the city environment, we are actually seeing better response.
Okay.
But hopefully that is reflected everywhere. But
Mhm.
that is one myth that we used to think, like, okay, I am looking perfect, I might be perfect.
Yeah, I don't
So
have a
outside-
problem.
Yeah, I don't have a problem. So that is one thing.
Yeah.
And if there is any problem with fertility, it has to do with
The girl.
the girl.
Actually,
That
it's
is
a
one.
very welcoming change, isn't it?
Yes.
It feels very
It
good
would.
that we don't have to carry the burden
Yes.
all alone also.
Alone.
That the
And,
shame.
yeah. Now we see couples coming and they will only ask first, So should we both get the tests?
That's
And it's
nice.
very, heartening to see that.
That's really, doctor. That's
Yes.
really nice to
Yes.
hear that. And also, doctor, the delayed periods,
Yes.
right? Some people get once in 3 months.
Yes.
So there is some people think that once you get married, everything will be all
Yeah,
right.
yeah, yeah.
That is a
Not
myth.
really. That is
Okay.
a myth. So regular periods is very good sign
Okay.
of reproductive health.
Okay.
So when someone is getting regular periods, they can be fine.
Okay.
But just maintenance, that's all it takes.
Okay.
But irregular periods might not be a very healthy sign, especially if it's getting delayed and delayed. Some people will not get a periods for more than 4-5 months.
Oh,
And so for them, at least one checkup. There are some which can be completely reversed
Okay.
just with the lifestyle changes. So all they have to do is some motivation, just do checks and tell them everything is fine, good diet, exercise, come back and see me in 3 months, everything is normalized. So
Yeah.
the hormone balance will just happen so naturally. So for them we feel okay. So if you have irregular periods, first consult,
Okay.
get the evaluation, and if everything is fine, it's not like, don't get worried that the moment I go I will have so many things to do or everything will be a problem.
Right.
Whether you go or not go, if there is a problem, there is a problem.
There is a problem.
So why delay?
Exactly.
Why
Get a
delay?
consultation,
Yes,
and
yes.
then you can take a
Yeah.
call what to do
True.
about it. Right.
True.
That really makes sense,
Yes.
doctor. In this journey of infertility, which is by itself is a little tough on the
Takes time.
couples and the people around them, branding
Yes.
and the name calling and shame
Yeah,
one has to
yeah,
go
yeah.
through. How can couples support each other in this journey?
Actually, some couples do struggle a lot
Yeah.
while going through the treatment. It is
Okay.
not easy because every cycle they come with so much of hope, positivity, and we want them to be
Yeah.
very positive, hopeful, for them to have a good, successful outcomes. So we encourage them. And if one cycle we try, treatment fails, and it's a lot to take.
True.
The moment the period starts, then comes the emotion, and that is the thing that we have to also counsel them. So we warn them, like when we start a treatment, we warn them that there is a lot of stress involved in the emotions involved and it might be a very short journey or it might be a very long journey. So they have to be prepared. So sometimes they think, okay, 1-2 months they organize everything, and then suddenly again they have to organize work schedules, appointments, everything. That
Yeah.
also is a thing. And lots of, like, so many visits to hospitals, and especially when with so much of hope there is a period, then that is when
Yeah.
people do come with a lot. So we, by actually a good awareness, saying that the proportion or the chance of pregnancy is only this much,
Yeah.
they are better prepared for negative thing.
Right.
But they still have to start their next cycle with the
Yes.
more positivity.
Yes.
So I think we encourage them to talk to each other, spend some time together, go for a walks, both for their health and for time together. That helps actually both.
Because the support, emotional support is very much needed because
Yes.
they both are as a team in that.
Yes.
Right.
Yeah.
And particularly for women, when the period happens, it's
Yes.
like, oh my God,
True.
one more time. So at that point, if the husband or the partner who gives that emotional support,
Support.
don't worry, we are in this together, I think it makes
I
the
think,
journey a bit
yes,
easy, right?
yes.
Thank you, doctor. Many couples delay parenthood today due to many reasons. What should they be aware of, but they are often ignoring? What is that, doctor?
I think it is the biology, as we talked earlier.
Okay.
I think now people are very good about lifestyle things, so they talk a lot and they are doing also, which is very, very welcoming.
Okay.
But at the same time, they think, why can't we overcome all these biological factors? We are doing so good with our dieting, we are so good with our exercise, so now they cannot accept like biological things like aging as a factor for fertility concerns, or so for them it's hard.
True.
We say yes, but not everything is reversible. We welcome all those lifestyle changes, but something that is not under our control is
Right.
something that we have to accept. So I think we just have to tell
Yeah.
these things, and then they can be warned.
Yes.
So when they are taking decisions of delaying if they talk about all these medical things and then take a decision to delay, and they are entering that with awareness, then
Yes.
that's fine.
Yeah.
So decision is all them. So, but once they know, they are aware of, okay, what if after few years they decide other ways? So then what are their options? And then let them take that decision of delaying, then that's fine.
Absolutely, because it doesn't come as a
As a
surprise
surprise.
after 3-4 years that my clock has
Yes.
ticked.
And also they do comparisons.
Okay.
See, someone in their office will conceive at 35, 40, so they think that's normal. And celebrities are conceiving late, they think that is all normal. And so that reflects, like, so those things, each individual is different. Accepting that why it happened to me, but it did not happen to others,
Yeah.
might be difficult. So, for before decisions, if they consult, get a good awareness, and then take the decision, perfect.
Yeah, I think a decision related to parenthood should
Yes.
be taken after a consultation with a doctor.
Yes.
Not by looking into Instagram
Yes.
or looking into celebrity
Fancy things. Yes.
profiles. No,
True. True.
it is going to come as a shock for them later, right? Okay, doctor. So there is a lot of fear around treatments like IVF,
Yes.
which helps couples in fertility. So what do people misunderstand about these procedures?
IVF, I think, major misunderstanding is lack of trust.
Okay.
So sometimes we do hear here and there, okay, they do something else, like, they mix up.
Okay.
So these are the major anxieties some people do go through.
Okay.
But very, very strict laws everywhere around the world. Lot of ethical things, work are going on.
Okay.
I agree, accept that there might be here and there, we see some things, but I think that created lot of mistrust.
Right.
So, and IVF also, once upon a time, was quite stigmatized. Test tube baby is not your baby, not real baby. No, those are the things that people are now overcoming, and many know now about IVF. Nowadays, we see children in their class, they're all IVF babies.
Yes.
So many multiple gestations, so many twins.
Yes, true.
So we see
Yes.
them a lot. So
Mm.
that says that, okay, that acceptance in the society is coming.
It's coming, yeah.
And now we see the earlier generation also accepting for their kids.
True.
Okay, IVF, yeah, we heard about it. It is not
Yes.
like, oh, this is something new.
Okay,
Yeah.
okay. That's good.
Yes.
Instead of feeling sad for
Mm.
not having a child,
Yes.
at least there is an option they can try
Yes,
for having their
absolutely.
own child. If
Yes.
not, then there are many options like you can
Yes.
adopt a child. But you have an option, right?
Yes, absolutely.
Yeah.
I think we should know all the options.
Yes.
And then proceed with whatever choices, then that's fine.
Well explained, doctor. So, at what point should a couple seek medical advice when they see that they are not conceiving?
Ideally, as early as possible.
Okay.
But when the couple, young couple, they are in 20s, so, and they are aware, okay, they are well educated, and in these terms also, like they know everything, still we advise them to consult pre-pregnancy.
Okay.
Like before planning pregnancy, not just before, like, early in pregnancy, but even before planning pregnancy, how long should they wait? All these things. It can not be generalized, but very individualized to the couple. Maybe if it is not just the age, thinking that,
Yes.
okay, you are in 20s, you can wait for 1 year.
Yes.
They might have other medical problems. They might have some thyroid which is not getting under control. Maybe in their families there are some genetic problems that run in one of their families. Anything like, that comes up. So to make health as the priority, or making that under control. If they have any medical problems, autoimmune disorders, epilepsy, anything, like people now can sort like into the pregnancies.
Okay.
But we can optimize their health, and then tell them, okay, like now you're all settled in all these terms, let us plan.
Right.
And then we tell, okay, how long can you try natural? We want everyone to try natural and come with a natural pregnancy, but with a good health.
Right.
Optimizing health. So 1 year is prior, we used to tell, try naturally for 1 year, and if there is a problem, come to us.
Okay.
But that is changing, because when they start late, We cannot ask everyone to now wait for 1 year.
1 year.
Now what we are doing, we are running tests. And if ovary reserve tests, all these tests are normal, we still tell, okay, go ahead, wait for your natural conceiving. But if there is any concern we identify, then we are not delaying. We warn them, okay, you have these factors, there might be problems fertility, so make it faster.
Yeah.
Some will come, they want to postpone planning, they come, they get all the tests, checkups done, they come and ask, can
Okay.
we try next year or can we have a couple of years? Then we do all this.
Okay.
So, and then advise accordingly.
Okay. They do that with all the information.
Yes. Yes.
Right. Wonderful, doctor. So, in India, infertility often becomes a social pressure. So, how does this affect women's, particularly in their mind?
Yeah, a lot of effect. I think. I think the moment there is this, we follow one set of the thing, like our life first studies, marriage. As soon as you get married, have kids. This is unwritten rules.
Rules, yes.
And it's very hard to try and convince everybody around you.
Yeah.
But yeah, that plays a lot of stress.
True, doctor.
For both, actually, for the couple.
Hmm.
Now we see women will actually feel a lot of stress, and men also are trying to support. They are also going through a lot of,
Yes.
because now they are caught up between the elders and wife. So
yeah.
they understand wife's emotions, but they are not able to convince. So I think talking sometimes helps, but talking sometimes not help. So I think sometimes tuning ourselves. Okay, whatever people talk, we should not. That should not affect us.
Affect us.
So
yeah.
you have a plan. We don't have to worry. So I think we just tell all these things because
Okay.
we cannot change our full environment.
Of course.
But slowly, yes, maybe
Yeah.
a stern talking sometimes might help.
Yeah.
Yeah. Sometimes we do ask them to bring the families.
Okay.
We tell them.
Okay.
We
Okay.
tell them that just leave them alone.
Yes.
Once they have the good news, they will tell you.
I think the
So-
next generation will have better parents and in-laws, I believe. Who, like you and me, we won't force the kids or put
Yes.
pressure on the kids. I think they will have a better chance. That's so great, doctor. So, like you would have been you are supporting so many women and couple, and particularly when it comes to this infertility part, is there any story that has stayed with you that you would like to share?
Fertility, yeah, lots of stories will be there.
Please share with us.
Yeah, someone very young and had a termination without knowledge,
Okay.
not of information,
Mhm.
and that was quite at a younger age, and
Okay.
later they had problems, fertility,
Okay.
and then so much of guilt carries on.
Mhm.
So because of whatever, one pregnancy has come, and that was with quite ease,
Yes.
and then they struggle to conceive, and when going through that phase is very, very difficult.
True.
So to overcome that guilt, despite being all tests normal and everything, but later, after a year or so, with fertility treatment, when they conceived, then that full joy, anxiety, guilt, everything all together. It's difficult to express, but we can see in their eyes
Okay.
that gratitude of
Yes.
making things work for them, and then going beyond that guilt was heartening.
That's really, really amazing. And
Yes.
you get to watch this, firsthand every day in your
Yes.
life, I believe, right?
Yeah, I think we also go through that with them.
Yes.
So, though we can compartmentalize, but at that point of time, we also go through that emotion with
Absolutely.
them. But when treatment works, then we'll be equally happy.
Happy.
Yes.
Yeah. I mean, that's a big blessing,
Yes.
doctor.
True.
Okay. So, if there is one thing that you want every couple to understand about fertility, what would that be, doctor?
Fertility is on the rise.
Okay.
So, I think we cannot take it easy.
Okay.
So, I think with the new generation, we should be a little aware
Okay.
of this possible rising trends, and so be good with our lifestyle, whatever
Yes.
possibly we can do, and like have a stress-free life or some means to de-stress your everyday life.
Okay.
And also, yes, we have lot of information everywhere, but trying to channelize.
Okay.
So we have information that is needed, but not causing anxiety.
That's true.
I think
Yes.
that should.
And one more thing, what would you like to add about the habits people
Habits.
are hooking on to de-stress?
I think healthy habits are better to de-stress. So not as a glass of alcohol at night to relax. No,
Yeah.
an hour of walk at night. The same thing to
Yes.
relax is a good de-stressing means. So change
Yes.
the alternates and snacking.
Hmm.
When you just sit with friends, we're all like either dinner or place pub. So change that.
Yes.
So have some the healthy place,
Right.
a good park or a place where you can breathe fresh air and have some fruits with you. So
Yeah.
maybe I think that also will come soon. Like
True.
hangout areas will
Yeah,
be different.
maybe. Maybe once you
Maybe.
understand that this is not de-stress, actually
Yes.
it is adding more
Adding to.
stress. Maybe the people
Yes.
choose the way of de-stressing in a different
Yeah.
way, right? And that would definitely impact their health in a very
Positive.
positive way. Yeah, rather than no regret
Yeah.
later,
Hmm.
you can take charge
Of that.
when it is
Yes.
in your hand,
Yes.
right? That's amazing, doctor. So, infertility is not just a medical condition; it is a deeply a personal journey, and conversations like this remind us with awareness, empathy, and the right guidance can make all the difference. Thank you, Dr. Vinatha, for being with us and sharing with us all the valuable information and your thoughts and your experiences with us. And it's been an amazing experience talking with you.
Thank you so much. It's a pleasure.
Thank you, Doctor.